In the meantime, I had not abdicated my responsibility as a community person. I had my own political beliefs, and I supported the organization I belonged to politically. And I did many things for the community as well. I was interested in seeing that education for the school children went on very well, and had been a board member in 2 schools, in Nkwenkwezi and Elitheni, to be involved in what was happening in education. And I joined many other organizations in the community. At one time, I was the secretary for the Diepkloof Community Association, and I did that very well, especially after retirement. I felt when I was working as a nurse, I was just perhaps to the community the nurse who stayed at the first house in the street. And now I wanted to be a real community person. My role in community development, I want to believe, is from my upbringing. My father developed his community, and I learned development of the community from my father. When I had retired from work, I was approached by Mrs. Bomvana to join the organization which I also supported as a working nurse. For an example, when we had the labor strikes in the country from 1986-87, and I was now with the South African Nursing Association, I would appeal to this group of retired nurses and say to them, look, we are not objecting that the nurses are on strikes. The nurses have rights, have labor rights. But at the same time, the community, the people who are sick in the hospital, cannot be used as a bargaining tool. And therefore, I'm requesting you to go to the hospitals and at least be able to provide the patients with basic needs. Things like making sure that the ward is clean, cooking for the patients, feeding the patients, and so on. And they did that. When Mrs. Bomvana approached me, I felt it was an honor, and I had to join them and see what had to be done. The very first day I joined the organization was an election day, and I was elected as a chairperson. One of the objectives of this group from Mrs. Bomvana was that they were looking for an old age home for nurses. But by the time I joined them, I felt nurses were amongst other people, and we could not exclude them and make a special home for them. They had to be in a home where other people are. They are not that much special. And I sort of changed the way the organization was doing things to look at what does the organization do for the community. Throughout the years with Mrs. Bomvana, who did remarkable work, this organization, Soweto Retired Professional Society, was a group that looked at their interest. Like, for an example, holidays, going out, and so on. But were also available just as I used them as a resource group. When I became the chairperson, I felt it was time for the organization to be involved in doing things for the community as well, to actively do some things that could not be done by other people, not duplicate things, Like for an example, already there were many NGOs out there who were doing home-based care. And I felt we could not do home-based care in an area where there was home-based care. We had the expertise to sort of run an institution, and therefore we had to look for doing things like a hospice, which was our first program. We then approached the government. It is useless to decide what you want to do. You have to find out if the government does need that service. So we saw the MEC at the time, Gwen Ramakgopa, and she agreed with us that one of the things that were not available in Soweto, there was just a 9-bedded hospice. If we could at least provide a hospice in Soweto, so that at least there's a second hospice. We thought we were going to get some assistance from the government. We didn't know that we had to do things all the way out on our own. So using Mrs. Bombana's registration, which later on became an NPO, we applied for the hospice. When the hospice was now running fairly well, we looked at what else can we add. So one program led to another program. We were employing young people who had done home-based care training, and we're using them in the hospice. But they were too young to be left to be home-based caregivers only. And we felt we needed to develop them and provide a career ladder. And we registered, we applied for accreditation with the Health and Welfare Center for training, and we also registered with Umalusi so that we could become an FET college. We then started training for the Department of Health. Just now in 2010, we had our first mass trained people, 502 learners, who wrote ancillary health and community health care. We also felt, indeed, as the then minister was saying, Mandusha Balala, that nutrition played a major role in HIV and AIDS. Mind you, our hospice is not only for HIV and AIDS. We admit many types of illnesses. We have the terminally ill, we have the chronically ill. We didn't want to discriminate and have HIV and AIDS only. But then HIV and AIDS is the thing that we have to deal with as a country. So we felt we also needed to do some food gardening. We surprised ourselves with this food gardening. The very first year, we entered a competition in Pumelelo Innovations and won a silver award. We have now established 3 gardens in 3 separate schools, because in our premises now we don't have sufficient space for a garden. And food gardening has become our 3rd project. We also learned this a hard way, in that we would have a patient with HIV and AIDS with a very low CD4 count, send that patient back home with a CD4 count acceptable above 200, but this patient would stay at home for 2 and 3 months and come back, only to die this time. So we felt we had to follow up our patients and do supervision of HIV and AIDS. We don't follow every other patient, we only follow those with HIV and AIDS, and that serves as our 4th program. We are now also having, in partnership with Soweto care system. We are assisting organizations in database collection and reporting, so that at least people would start with NGOs but not have the skill like ourselves to report and also to record what they are doing. So this Soweto care system assists them. And we want to believe those 5 programs that we are running are what we need to do. We leave other things with other people. That the whole thing is exciting, and the only challenge we have now is transfer of skills to younger people. We would like, when we should pass on, and that the organization should also fall into pieces, we would like some other people to continue. It's not an easy task, because to take people who don't have the vision that you have, it's not very easy for them to follow up. And also, we have to admit that people were marginalized and they didn't have much information as they should. But we're going on. What we have done now is to decentralize the services, so that in other areas, at least, we make managers young people. We have a young person doing food gardening, we have a young person doing finances, and we have a young person who is looking at procurement. So we have decentralized services, and I think it is exciting. This last Saturday, the 13th of November, we had our 502 learners graduating at Kliptown. We chose Kliptown for sentimental reasons. The Freedom Charter was launched in Kliptown, and we also believe we are launching what will address the country's healthcare problems, resolving the country's healthcare problems in Kliptown. In that service delivery, healthcare service delivery is one of the major problems we have in this country. And if we train these children who cannot enter into tertiary level education, give them career pathing, they will eventually become registered nurses one day and solve the country's problem. And some of them, we can actually use them in client homes, use them in clinical institutions, and use them for the broader community. And I think we're making a difference in the country. I am the person who is at the head of everything.